The alarm clock. Quite possibly the worst invention ever made by man. The pure fact that you had to be woken up proves you didn't get enough sleep, doesn't it? Well, for a lot of us, the morning fog can take a while to burn off. And for some, it hangs around all day long. And that can be a sign of a problem like sleep apnea.
Sleep apnea is a very simple concept. When all of us go to sleep, our upper airway relaxes, narrowing that breathing space. People with sleep apnea are individuals whose breathing tends to block off. The way I explain it to patients is if you went to sleep and then somebody started choking you once a minute or twice a minute, and you woke up and went back to sleep, and then somebody jumped in the bed and started choking you again, woke up. And so people with clinical sleep apnea end up with very interrupted sleep. Essentially, some of them never really get into anything like normal sleep. They may go into the very earliest phases of sleep.
There are a number of causes of sleep apnea. First, make sure it's not actually your spouse choking you throughout the night because they're fed up with your snoring. If you've ruled that out, you may simply be the unfortunate winner of the genetic lottery that's rewarded you with a short neck and a narrow airway. Everyone's throat relaxes when they sleep. It's just that most airways are still big enough to allow air to pass in and out, although through a smaller space than when we're awake. When the breathing tube is naturally narrower, there's a greater chance for blockage. In children, tonsils are often a common cause of blockage, and for the elderly, the natural aging process leads to loss of muscle mass, causing the airway to relax more than usual. And another common culprit? Obesity. In fact, about half of all patients with sleep apnea are also overweight.
And when we gain weight, people think that they gain weight in their bellies and their rears, but the first place we gain weight is in our throat, and the fat tends to deposit in the throat, narrowing that breathing space.
Not getting enough sleep isn't just about being tired all day. Its dangers stretch beyond being fired for lack of productivity or getting sleepy behind the wheel of your car. Sleep deprivation also affects other body systems.
Because you're cutting off the oxygen supply is associated with increased risk of stroke, heart attack, and it cuts off the oxygen supply to the pancreas so that your insulin supply is affected and your sensitivity to insulin is affected. So it seems to be one of the promoters of the diabetes epidemic, and in totality we call it the metabolic syndrome.
Thankfully, doctors can do a lot to help you recapture some of those precious nighttime hours, from prescribing decongestants or sleep aids, to removing tonsils, to small ventilators or mouth guards. But it is important to have a doctor discover the cause of your insomnia. Imagine taking a pill to keep you asleep while your body's trying to wake you up to breathe.
If we give a sedative to someone who has sleep apnea or airway resistance, it's going to relax the airway more and worsen the problem. That's why we do the sleep studies, to try to define what exactly is the problem when somebody says they have insomnia, or some people complain of so-called restless legs, but actually they have sleep apnea because as they're choking, they kick and wake up.
So, if you're feeling like someone has taken the Z's out of your sleep and put them into the buzz of your alarm clock, talk to your doctor about it. Your body and your spouse will thank you for it. I'm Dr. Keller Wortham, and you're watching the eHealth Network. Back in a bit.